Mm.
Thank you, Madam Chair. My question is to the Minister of Indigenous Affairs. First Nations across northern Manitoba and many across the country have been doing everything possible to keep COVID-19 out of their communities. Many here have implemented strict lockdowns or travel restrictions. But the federal government has done virtually nothing to deal with the chronic issues that have made them vulnerable in the first place, such as overcrowded housing and the lack of hospitals. We have to be very concerned about a possible second deadly wave of COVID-19. So what is your government doing to support communities in the face of that? Why isn't the government supporting the call for a ventilation center in Berens River, a hospital in Cross Lake, a hospital in the Island Lake region? If the government couldn't act in time for this first wave of the pandemic, can it at least act in time for a potential second wave?
The Honourable Minister.
Well, indeed, Madam Speaker, one of the reflections we have to have coming out of this global pandemic is that we don't want to go into the next one with the same social determinants of health that have made Indigenous communities more vulnerable and more susceptible to contracting and then spreading COVID-19. A lot of the historic housing funds that we have mobilized in order to address overcrowding in particular are cold comfort to those communities that are still finding themselves in overcrowded situations. So as we look at the staged approach to the epidemic and the onset of COVID-19, there are many measures that Indigenous Services Canada and as a whole of government we will deploy, including surge capacity, increased PPE and nurses and doctors. Obviously, we are looking for a medical solution to a medical problem, and that is what we will spare no expense or resources to address as Indigenous communities continue to face the looming threat of COVID-19 or second waves as people start or communities start to relax some of the procedures and confinement procedures.